Hi, good afternoon, everyone. I am Dr. Pujan Parikh, consultant pulmonologist at Sir H.N. Reliance Foundation Hospital. Today, 24th March, is the World TB Day. Yes, we can end tuberculosis is the theme given by WHO. TB is very important to India because around 5 lakhs people died of tuberculosis in 2021 in India. TB is the most important cause of infertility in women in India, and around all the maximum mortality of HIV infected patient happen because of tuberculosis in India. That's why TB is very important to us. Around 40% of Indian population is infected with tuberculosis, and out of which around 10% population develops the TB disease. Those who have a low immunity, those who are diabetic, those who are on cancer, chemotherapy, medicines, alcoholic, chronic smokers are at a more risk of developing tuberculosis disease. TB is broadly classified into a pulmonary and extrapulmonary tuberculosis. Pulmonary means whenever lung is involved, around 80 to 85% times it is a lung involvement, and around 15 to 20 times it is 20% times it is extrapulmonary, means organs other than lungs are involved because of the tuberculosis. So brain TB, cardiac TB, pleurisy, pleural effusion, abdominal TB, lymph node TB, miliary TB, all this tuberculosis comes under extrapulmonary tuberculosis. So the spread of TB is through airborne. When a person suffering from tuberculosis coughs and the other person catches that infection, because of the low immunity, they can develop a tuberculosis disease. So, coming to symptoms, symptoms of tuberculosis are broadly classified into a organ specific or a generalized symptoms. So, in generalized symptoms, it is mostly a low grade evening rise fever, then weight loss, loss of appetite, fatigue. All these are general symptoms. In organ specific symptoms, say suppose person is suffering from a pulmonary lung tuberculosis, he or she will complain of a chronic cough which is more than 2 to 3 weeks, and cough comes usually with the expectoration which is yellowish or a greenish in color with a foul smelling odor. Along with that, some patient may complain of blood and sputum. We call it as a hemoptysis. Then chest pain or a breathing difficulty. These are the certain features of a pulmonary tuberculosis. So in extrapulmonary tuberculosis, suppose a person is suffering from abdominal TB, will complain of a persistent abdominal pain, recurrent loose motion or a constipation. Along with that, loss of appetite, persistent vomiting. Then those who are suffering from a brain-related tuberculosis will have a seizure episode. They get drowsy, persistent headache, vomiting. All these are the brain-related TB symptoms. See, the CNS TB, the brain-related tuberculosis, and the miliary TB are the most dangerous form of tuberculosis, where patient can died in the severe form of tuberculosis. Though the other TB patient can also die if the treatment is not taken properly or on not taken on time. Apart from say this abdominal and the brain TB, those who have a lymph node TB will get a swelling around neck. Then those who are suffering from skin TB will develop a skin lesion. So all these are the symptoms specific to the organ specific tuberculosis. So apart from this, say when we come to the diagnosis of tuberculosis, most important thing is the sputum examination and the chest X-ray for TB diagnosis. Those who are suffering from the pulmonary tuberculosis. Why sputum examination? Sputum examination is the easiest and the cheapest way to diagnose tuberculosis. By doing sputum examination, we usually send a gene expert and the TB culture for the investigation. These two are important to differentiate. First thing to diagnose the tuberculosis, and second thing to differentiate between a simple tuberculosis or a drug resistant tuberculosis, because the treatment for both differs. Those who are suffering from simple drug sensitive tuberculosis has a treatment duration of around 6 to 9 months, and those who are suffering from drug resistant tuberculosis, the duration is up to 18 to 24 months. The Number of medicines also increases in the drug resistant, that is multi-drug resistant and the extensive drug resistant tuberculosis. Apart from this, the chest X-ray is also important to regularly evaluate for the improvement in the TB infection. This is for the lung-related tuberculosis. Those who are suffering from abdominal TB may need a sonography or a CT scan of the abdomen. MRI brain is required sometimes in the brain-related tuberculosis. Biopsy is also one of the important thing in the diagnosis of the skin tuberculosis and the lymph node-related tuberculosis. So the investigation varies from the organ to organ. So Montauk's test, and some people are nowadays doing a IGRA or a TB Gold test. So these are the tests which only tells us about the infection of tuberculosis. As I told you earlier that around 40% Indian population is having TB infection. So this Montauk's test and IGRA test can come positive because the patient has developed an immunity against the TB infection. So Montauk's test and IGRA or TB Gold positive report doesn't conclude that patient is having TB disease and needs a treatment. It is different in the foreign countries. They don't have, say, in the Western world, in US or UK, the TB is not that prevalent, and that's why if they get a positive report of a IGRA or a Montauk's, the treatment strategy differs from what we are doing here in India. Coming to vaccination, so we don't have a good vaccine against tuberculosis. BCG is the vaccine which we give to all newborn Indians. However, this vaccine only prevents the severe form of tuberculosis. It will not prevent the transmission of a basic form of tuberculosis. Good immunity is very important to fight against the TB infection. So, good nutritious food, high protein diet, and wearing a mask while going to crowded places is some basic tips which we can do to prevent the transmission of TB infection. So the our aim with in this year should be to reduce the TB burden in India so that we can get rid of this disease. This disease was found in the spine of mummies as well. So we can come to know that how old is this, how ancient is this TB infection, and we want to get rid of this TB infection and the disease. Thank you.